The idea that all of this can be blamed on a virus that was novel in 2020, where we did not know a whole lot, and where, I just want to play this because I think people forget sometimes, where the president at the time was Donald J. Trump, and this is what he said about vaccines at the time. His own vaccine, by the way, that he helped develop.
You tell parents about getting their kids vaccinated. Measles, I'm the measles. Tell parents about vaccinations.
They have to get the shot. The vaccinations are so important. This is really going around now. They have to get their shots.
So that, on measles, Trump in 2019 was get your measles vaccine. Operation Warp Speed, some people say he should be nominated for the Nobel Peace Prize. A fair argument to make. But now all of a sudden, this is about being lied to when people did not know a whole lot about COVID at the time.
But let's take a big picture view. The COVID vaccine ended up being a miracle drug.
It did.
There is no doubt about that. You can say that certain people later on in terms of booster shots should or shouldn't have gotten this, young men, you can make all those. The bottom line is it was a miracle drug, period. We have to start from that perspective. Then you talk about other vaccines, right? We're not just talking about COVID. If COVID's an excuse to basically say, well, we can't listen to anything. They're all lying to us. All these vaccines are bad. No, they're not. They've been proven year after year, decade after decade, putting aside COVID for a minute, that the rest of these vaccines work. So the fundamental question becomes, do you view this through the prism of I, or do you view this through the prism of we? Exactly. If you view it through the prism of I understand the point, which is, why should I be forced to get something that I may not want to get? I get it.
It had side effects.
I hear it.
Heart issues.
But look, there are medical exceptions. But there are medical exceptions in Florida where if you have a medical condition right now, you don't have to get those vaccines. If you have a medical exception, the point is, if you view it as a we, as a community, we did that. It was a failure.
So listen,
but that's the part that you're missing about the American people. Measles has been a failure?
No. I'm going back to COVID-19 and why we're having
I know that it's convenient to go back to COVID, but we're
talking... That's where this started.
No, it
Everyone
didn't.
trusted them before COVID-19.
Right now, in this... Hold on, Ben. Right now in this country, Scott, the question is, should children going back to school, you also have kids... I don't know if they're vaccinated or not. I presume they probably are. If they are going back to school, should they have a vaccine for polio? Should they have a vaccine for measles, mumps, and rubella? Should they have a vaccine for any number of things
for chickenpox
that we don't even talk about anymore because it's not really a part of American life because we've eradicated it because of vaccines? Should they?
Yeah, I think it's indisputable that vaccines have saved millions upon millions of lives, and that these vaccines for these diseases you're talking about work. I mean, they've been working for decades in many cases. So yes. I think that's fact number one. I think Dan raised an interesting point about you could hold two thoughts at the same time. You could believe that they work and believe that you don't have any questions about it. And you may also believe that the government shouldn't make you do anything that you don't want to do regarding health care.
Government makes you get a license.
Whether you have concerns about the vaccines or not, there are people who do not believe that the government should be able to mandate.
Government makes you wear a seatbelt.
Anything like that. Well, there are people that don't think that.
They don't make you drive.
And so,
they don't make you drive.
Yeah, but I think it's possible for people to hold. So anyway, I think that's kind of the debate that's going on.
The government
personal liberty.
That is the debate. But I think Dan's point is, and I think this is super important when it comes to vaccines. Vaccines are not just an I decision. They are a we decision because they don't work as well unless and until we all participate in them. So that is part of what was the discussion here when it comes to mandates, because we are all protected when we are as a community vaccinated. Yes. We are less protected when we are not vaccinated as a community.
The two things that are really troubling in this whole debate is the fact that we do have to collectively make a certain level of sacrifice, and getting vaccinations are part of that sacrifice with a glorious outcome for the majority, with a few exceptions. And to see the president, the leaders in Florida play political games of vaccinations, to see people cheer this on, not really understanding the full impact of what this is going to do for political expediency. And the second point, very irrational, irresponsible for him to compare people having to get vaccinations with chattel slavery. There are no other atrocities. They would never make that comparison when it comes to the Holocaust, but you want to make that comparison when it comes to chattel slavery. It is reprehensible that he would do that, or anybody would do that, that cavalier nature. And all it continues to do is amp up the animus in this country for reasons
Can
that...
we talk about Florida specifically just for a minute? So in Florida, approximately 88% of kindergartners have their full and complete vaccination. That is already below the recommended amount if you're going to achieve herd immunity. If you take away the vaccine mandates, you're going to see that number plummet. When that number plummets, not only are households going to be infected and potentially get sick, but the most vulnerable people in those households, and those are children. Without mandates, we are not going to adequately protect our children. And we've already seen, let me finish. That's not bullying. We've already seen evidence is when we don't protect children, children are left susceptible to irrational decisions of adults. We have children in the United States dead from measles. That should not happen in 2025.
Ben, how do you with a straight face?
It should not.
Seriously, how do you with a straight face can anyone justify, even if you don't like the COVID vaccine, saying that because you don't like the COVID vaccine, you should open up the Pandora's box
to everything
of diseases that we have put on the put on the back burner of public life. So why would one thing even remotely justify the other?
When you have the CDC that does not have the trust of the American people, and clearly in Florida, they do not trust the CDC with their children.
This has nothing to do with the CDC.
Yes.
This has to do with Florida public health.
You can lecture the American people all you want to, but I'm trying to explain to you why parents are saying, I don't trust.
I know that you are trying to justify
it,
but
I'm justifying. It is explaining
this is actually not about
people, by the way, if you don't like us in Florida, you can move.
This is not about the parents at this point.
Sure it
is.
It's absolutely about the parents having the right to choose their kids over a state.
This is about the policymakers,
you must vaccinate your children.
Ben, this is about the policymakers. This is about the governor. It's about the Surgeon General.
So why is it so popular?
Why
is it so
are
popular
they willing to sacrifice the health of millions of children because they don't like the COVID-19 vaccine?
You guys won't even admit that we got it wrong with COVID at this table.
Are you so sure that parents still don't get their children vaccinated?
Yeah, you're
even without
Hold on a second.
I think you're raising an interesting question about the numbers. You said millions of children. Are you so sure that parents won't get their children vaccinated without a mandate?
I think that,
the mandate.
I think
we already have.
They could still get them vaccinated.
We already have data
addressed that.
Not enough. We already have data.
But if you want to blame somebody for this, blame the CDC for losing the trust of the American people.
Okay, you're wrong again. Okay?
No, I'm not.
We're
having this conversation because the American people don't trust the CDC.
Let's talk about political actors who started to spew intentionally misinformation
because the CDC misled and lied to the American people during
which has led
shutdown
to
of the world.
Confusion, has led to chaos, and has led to an unnecessary loss of life.
Then you should talk to the
know
CDC.
why we were able to save the lives that we did? Because public health
with the scientists that lied to the American people.
That's what's dangerous. Be angry with the scientists. Yes,
we wouldn't be having the conversation.
No, but what I'm saying is that if we just kind of think through this, I mean, I think we all pretty much agree that
this conversation would never be happening.
But I'm saying, okay,
for the lies of
but
COVID-19.
There's a way to talk people through the differences of what happened during the COVID pandemic.
Sure.
And the global,
and that's where doctors come in.
And the global impact. Well, we got
I'll be honest, the arrogance of doctors is not going to get parents to come to your side.
It's not about the arrogance
You're yelling at parents who are skeptical of the CDC.
We have to end the conversation here, but
bleeding lies.
You do sound a little bit like a broken record on this one
because it's that simple. It's the same thing over and over again. You lose the trust of people on any issue, they will not listen to you.
You're diagnosing the problem, but you're not offering a solution. The solution
don't lie to parents.
The solution to this is not take away the vaccine mandates. The solution is to reassure parents about the safety and efficacy of vaccines, which are really not in question. But rather than doing that, policymakers are not doing that. And I think that is, nobody is disputing that.
Then here's
They're
what I would
not
say.
doing that when we know the facts around
I can agree with you. And here's what I would say. If doctors are this upset about it, than actually speak
we are.
without
A lot of people
condemning
are.
parents, implying that they're going to kill their child.